All right, so continuing the simplified instrumentation. Angulation. I feel like angulation needs its own slide because I feel that it's the most complex part of instrumentation. It's the hardest part to do, in my opinion. Maybe it's easy for you guys, it's not as easy for me. Geometry. Who took geometry? High school, college, I think everybody probably has. So I get the most blank stares when I start talking about right triangles or things like that. So this is basically just to review it, kind of give you guys a better visual of what exactly we're looking for. So the angle between the tooth being instrumented and the lateral cutting edge of a scaler is the angle that we're looking at. As you can see, these slides over here have a, does that say Akira? No, it says ouch. I was like, that looks like a sickle. So if it's too open or too closed, those are other words that I kind of get confused looks with sometimes. For the insertion, you guys already know these ones, 0 to 40. Calculus removal, the book says that it can be anywhere from 45 to 90. That's a huge range, I feel like. But the ideal calculus removal, you guys are going to find discrepancies. The old text used to say it was 60 to 80. Now they've kind of honed it down on the newer edition, saying that calculus removal on the enamel surfaces or the coronal aspects are going to be 70 to 80, and any root surfaces are going to be 60 to 70. So the ideal is going to be your 70 to 80 for that coronal calculus removal. Well, that was like magic. One thing I do want to point out from the last slide when someone was describing angulation, I thought this was the perfect definition in their own words. I'm not going to tell you who the student was, but it was pretty good. It says, the angle at which you keep the instrument blade when inserting and removing calculus in relationship to the tooth. No one could have said it any better. All right, guys, so calculus. Are you guys laughing at me?
I said that later.
That was you?
No.
Oh. All right, so with calculus removal, effective calculus removal depends on a combination of different things. We already identified some of those at the beginning. Firm lateral pressure and correct angulation. Obviously, those other things need to fall into place as well. I've read a ton of different texts, articles, and even in our Neal book about the angulation adaptation, and it seems like a lot of those words are easily confused, activation, adaptation, and angulation. And so whenever we're standing over you as instructors, if you guys can always keep those definitions separate, then it's easier for you to understand exactly what we're trying to get you to improve on. This definition was taken out of your Neal book, and it says, it was actually, the heading said that it was for lateral pressure and adaptation during calculus removal, but underneath of it, it didn't discuss anything about adaptation. It just said, with ideal lateral pressure and angulation, a calculus deposit is fractured from the tooth surface. So even in our text, it's showing that sometimes things can get a little bit confused as far as the verbiage goes. So again, the key words that you guys need to remember whenever we're helping you guys out with your instrumentation, and again, it's not going to end at the end of the semester. Us helping you is going to go until the day you graduate. And even after you're in practice, you're going to be hearing these little voices in your heads. In fact, I hear one of my teachers, Miss Interline, about ergonomics. She was like the ergonomics queen. Anytime I start leaning over, I'm thinking, okay, sit back up. And it's been, what, 12 years? And I still hear that. So, like I said, these words will stick with you. But the adaptation, again, tip third, activation, wrist or digital, lateral pressure, force created with your thumb and your index finger, and your angulation is the tooth to blade angle. Angulation comes with a taller fulcrum. That's kind of synonymous. All right, so a couple questions first. Can you be properly adapted and have the wrong angulation? How many hands agree? Anybody disagree? Okay. And can you have the correct angulation and not be adapted? Agree? Disagree? Agree. Yes. Good job. This is one that seems to confuse some people when I'm in clinic with the big, huge scalars. You know, even if we're not adapted, but I can still have that right angulation, right? Even though my tip is hanging off. Am I going to be effective? I might be effective removing calculus, but I'm also going to remove a ton of gingiva. Not ideal. But can I be adapted and not have the right angulation? Absolutely. And that's be, too open, too closed, face against the tooth, not that open, ideal angulation.